Hi, welcome back. I'm Laura from Front Office Rocks, and you are watching me on our YouTube channel, which is a place I like to spend a lot of time adding content, sharing ideas, discussions, things that people bring up either when I'm speaking or our clients ask or when I'm out talking to clients. So in this one, we're going to talk about productive scheduling or block scheduling. And the reason I want to talk about this is I don't know that it's fully been explained to many doctors and team members the importance of it, why an office should be doing productive scheduling or block scheduling, why we need to make sure we train our team members on it, and those that have tried it and it's failed, the reason why it's failed. Because if we can understand why it fails, we can be better at implementing it the next time. So what productive scheduling is, or block scheduling, is basically to build the schedule or in an organized fashion in a manner that we are planning for where appointments will go. Many dental offices just sort of put things in the schedule where they fit. We just kind of put patients in, the times they want to come in, where there's a little hole, even though the appointment doesn't fit. If we have a big appointment we're trying to get in, we sideline them. And what happens is we run a crazy schedule that's not productive, we're exhausted, and at the end of the day, we're kind of like, what happened? With a productive schedule or block scheduling, the way it works is you plan ahead where appointments are going to go in the schedule, and you block for your productive appointments. So usually your productive appointments are your larger appointments. You actually put blocks in the schedule and you hold those spots for the larger appointments. Now, there's two reasons for this, and two reasons that's important. One, for the office, because you want to hit your daily goal every day, and productive appointments are going to help you get to your goal faster. So if you hold spots for the appointments and you fill them with production, larger appointments, it's going to help you reach your goal faster. Plus, then you're not going to sideline and try to cram a lot of patients in. You're actually going to be able to have the time and the attention to give to the patients. It's also a benefit to the patients because typically our larger production appointments are our more urgent appointments, the ones that are like a higher priority to have to get done sooner. And we want to get our patients in right away. So if we can block or hold spots in our schedule so that if we get a patient today, we'll be able to get them in the next few days to get that treatment done, that's way better for the patients and helping the patients keep their teeth for life. So there's a benefit to both the office and the patients by productive scheduling or block scheduling. You have to hold the spots. Now, the reason that it doesn't happen a lot of times is a lot of times dentists don't really understand it. Maybe you've heard the term, maybe you've read a little bit about it, or you've been to a training that kind of told you the concept of it, but we haven't really spent the time explaining why it's important and then making sure our team understands how to do it. That's part of the reason why at Front Office Rocks, we have an advanced scheduling training course just for this, because I meet people all the time who've been a scheduler for years and nobody actually taught them the basics of how to build a productive schedule. So it's super important that your team understands how to build a productive schedule, because you're going to hit your goals, you're going to take care of your patients better, and your team's going to live a happier life when we're not running around like chickens with our heads cut off. Now, for those offices that have done this in the past and it failed, the reason is typically because we're not following the policies and training our team to understand how it works. When you have an office where 2 or 3 or 4 people are potentially putting appointments in the schedule, where you have an office where the doctor doesn't really understand block scheduling and they just want to put patients in on the day or time that works for the patient, the schedule sort of falls apart. It's super important that everybody who touches the schedule understands how to build a productive schedule, gets the training needed, that the doctor understands the importance of it, that the whole team gets the concept around it, so everybody supports it, and then that you follow the actual systems of how to do it. Block the appointments, hold them, and then don't put anything in there until you get a production appointment. So that way you can fill the schedule appropriately, take care of your patients, lower the stress in your practice, and actually build a productive schedule each and every day. So again, this is just kind of an overview, but I think a lot of times we hear about it and we shake our head like we know what it really is, but there's an actual system to building a productive schedule. There's training that's needed, and there's a way to do it so that it's each and every day I can't guarantee you're not going to have emergencies and upsets and cancellations, but most days you can hit your daily goal easily and not stress about what the day is going to look like and have crickets, chirping because you don't have any patients in the chair. So learn about productive scheduling. If you need help with Front Office Rocks, we have an advanced training on this where we can take somebody who doesn't even know anything about dental offices and teach them how to build a productive schedule. But it is vital because the schedule is the most important system in the dental office. It's the one that runs everything for our team, for our patients, and the better we are at scheduling, the less stress you're going to have, the more productive you're going to be, the better customer service you'll be able to give your patients. So it's worth it to take the time and learn it and implement it into your practice. Again, if you need help, let me know. Write comments below. We're available at Front Office Rocks. Bring up suggestions and questions you might have about other topics, maybe something you've heard about but nobody's ever explained, and I will do my best to explain it here. Again, thank you very much and have a super duper day.